Breaking a bad news. So I'll be discussing about the best practical guidelines. How can we break a bad news? So in this, first of all, we have to make a plan. So if we make a plan, then only we'll be able to give, in a better way, the bad news. So first of all, we have to confirm the medical facts of the case, and we have to do some research about the case, like what is the diagnosis and how long, what are the symptoms that he has been right now, and what are the treatment that has been done. So all the things should be, is gathered, and after that we have to create an environment in which a patient is comfortable and both seated, and we can maintain a privacy where possible. So after that, we have to give adequate time and plan that our conversation might not be interrupted by any other disturbing factors like phones or any blips. And what we can do next is we can offer a patient, like anyone who are coming with them, like do you want to be with them or not. And it's entirely a patient choice whether they want to be with their next to kin or any other friends or any clinical nurse specialist, or they want to be alone. So, and if the patient age is under 16 and the information about the disease prognosis and treatment belongs to the parents, so you can't just ask the small child to be with us and disclose. We have to make sure that there are some relatives, mostly the parents are there to allow the child to be present. Yeah. And as this will encourage the openness and avoid later collusion. So after that, what we can do after that, we want to know how much patient know about the condition, or they have any kind of things that is being running in their mind, like what we can say. uh, we can ask, like, what do you understand about your condition, what test have you had, how would you describe your illness, have you been worried about your illness. So these are the questions that we can ask to the patient, and we have to know, is this the right time for the patient to tell. So for that we can ask, are you ready for us to discuss your test results? We need to talk about your results. Do you want me to go over your test results now and explain what I think is going on? So by saying this, we'll give the opportunity to the patient to arrange another time or place. So after that, we can gently warn the patient, so that we won't give news, a serious news, as a shock. So what we can do, we can say, I'm afraid your condition looks more serious than we thought, or I'm afraid your condition is or appears more serious than we thought. The news is not a good news. The news is not a good as we have hoped. The results of your scan or test are not good. So what, after saying that, we can share the information, like how to share the information, like we have to observe the verbal and non-verbal cues of the patient, and if the patient indicates that they have heard enough, then stop. Give the time to the patient to assimilate each piece of information, and we have to use simple language, like we have to avoid medical jargons at the time, and we have to check the information that we have, whatever we have said to the patient, they have understand till now or not. So we can say, I know, patients sometimes worry about how they will explain all this to their relatives and friends. Would it be helpful for you to go over what do you understand from our discussion today? So we can say these things to the patient, and we can allow them to be still and silent for sometimes we can't be in a hurry just to complete our station, and give the patient time to ask about expression of their worry or concern. Do they have any kind of worriness at right now? Address what are the further investigations, treatment options, and support can be given. It is important to be honest during this discussion rather than over optimistic. So after this we can talk about follow up. Yeah, so what next, what can be done? Make sure the patient knows when they will be coming in the next follow up, and by whom, so that they can prepare further questions. Offer to them, like we can offer a written information of a consultation including main points of diagnosis, treatment options, and this documentation should be done so that we can inform the healthcare professionals, our ward team, or our GP also. Thank you.